So what are people's, let's just get people's thoughts on grief, just in general. So Carol's written something interesting here. I did a paper a long time ago about grief and how it is important to humans. Yeah. And there's many other sources at the time mentioned about the stages. How long ago was that, out of interest? Yeah, 2006. Okay. Yeah, it's quite a while ago. So I don't know if people are familiar with CRUISE. I've just had a quick look at the 5 stages. CRUISE, I don't know if they're outside of the UK, but they're a very well-known bereavement support. I think I'm not sure if they're a charity. Yeah, they're a charity because you can make a donation. So I'm guessing they're a charity. They have a helpline people can access. They're really well known. And I've just had a quick look at their website. So let me just I just need to find the right window. Hold on. So for those who don't know, I know you can't see the chat bar there, but in fact, there we go. Look at that. I quite like this OBS program, it's not as hard as I thought it would be. Let me just lock that in place before I move it by mistake. Wow, look. Cooking on gas, we would say in the military. Cooking on gas. So this is how I was taught when I first became a nurse. I learned it around the 5 stages of grief. And it was developed by Kubler-Ross here. And essentially, they found that there were 5 stages. And the stages are denial, as you can see, anger, bargaining, depression, and then acceptance. And this is probably what most people have come up with when they've looked into kind of stages of grief and they've looked into grief research themselves. Now, what does it say here? Do they happen in order? Because this is one of the limitations or critiques, I guess, of this staged model, is that it doesn't actually happen in order where you go from one thing to the next. So you don't necessarily go from denial to anger to bargaining. It can jump around. You can go from one stage to the next, then back a stage, then miss out a stage and go to another stage. And people might not experience all the stages completely. So it starts getting to the point where, well, you might not do all of these. You might do all of them. You might do them in order, but you might not do them in order. CRUISE starts saying, are the 5 stages useful? And their answer is, yes, they're useful for understanding some of the different reactions you might have. But it's important to remember that every grief journey is unique, which is fair enough. And then we have, since the 5 stages were first developed, there's been lots of new ways of thinking about grief. At CRUISE, they try to stay up with research, stay up to date with research. We know there are many ways to experience grief and many models to help us to understand a bereavement. One we find can be helpful is the idea of growing around your grief. In this model, there's no set stages or phases to bereavement. Instead, your grief remains the same, but as you grow as a person, it takes up less space. So a few of the critiques of the stages model is, it doesn't take into account things like your culture, your spirituality. It doesn't take into account things like physical symptoms you might feel. It doesn't take into account behavioural symptoms you might feel. So it's to me, it's a very narrow way to look at it. Although I appreciate that some people can relate to it, which is fair enough. Now, the model, growing around your model, is the model that I talked about in the Arcane episode, which is Tonkin's model. So Lois Tonkin. And this is essentially what the model is. So this is a nice pictorial representation. So here's your grief. And as you'll notice that as time goes on, your grief stays the same size. But what changes is you. So your grief doesn't actually change. You change around your grief. So you grow. And this is in fact, this is the only paragraph it gives for this. So what does it say? This view of grief does not tell someone that the grief will go away in time. And I wonder what that's like to hear. I'm guessing there's a difference to hear that when you're grieving versus when you're not grieving. That probably has a different sentiment to it. But it does say you'll never be over it, which I kind of quite like for me, because I think grief is something, some element of grief, it stays with you. Like the 5 stages could suggest, oh, when I've progressed through those 5 stages, then I'm over it. Like that's it. That's grief done. It's like that doesn't sit well with me. I don't think it is. Yeah. So like last thing says, so I think that's like the metaphor, isn't it? That Vi was or Caitlin was using, I think, which I was trying to fit on the fly in the episode. I was trying to get her analogy to fit into this analogy, which was quite difficult. But yeah, it's like, so what did you say? So the hole getting smaller, kind of. I don't know if the hole stays the same size, as in the grief in this stays the same size, and you grow around it. And this says, look, it acknowledges that there will be some days where you feel grief as strongly as you did when the person first died. Absolutely. I still feel this about people that I've lost. But there will always be days when there will also be days, when you're able to move on with other parts of your life. Sometimes people feel guilty about this, as if they're being disloyal. But the model shows how we can still grieve the loss of our loved one whilst carrying on with our own lives. And that makes sense to me. Let me just pick up, because there's another model I want to kind of join onto this to synthesize the two together, because I think they're quite helpful. Yeah, thanks, KG. Yeah, it is, isn't it? It's to me, it's a nice way to kind of visualize it, that there's a sense that it's never going to go away. I mean, maybe the experience of it, because as you grow, proportionally, that grief obviously gets smaller to the plant pot and the flower. So maybe from an experiential point of view, it feels like it's not as strong, but that's not because the grief is getting smaller, it's because you're getting stronger. It sounds a little bit confusing, maybe. Yeah, that's a nice way to put it, Sarah. So grief is the echo of the love for the person you have lost that you can no longer give. Yeah. And I don't know if you'd want that to go away. I don't know if that's something that you'd want to lose. Because to me, it would almost feel like losing that, you're then losing that connection with that person to some degree. Yeah, Harris, I think that makes sense. So grief has to shrink to some degree as people process. I mean, I don't like taking this perspective, but from a researcher, academic perspective, like grief is an awfully difficult thing to measure over time, to say, because it's not like a thing you can test. You can't take a blood test from someone and go, oh, you have this much grief. So all of this is kind of metaphor, analogy. It's all about understanding experience and where someone is at, in their life and how they're going on with things. So it's really difficult. But yeah, I mean, like I said before, proportionally, it looks like it does get smaller on this model because the whole thing's bigger. The tombstone of the grief might always be there, though, even though when you think you're over it. Yeah, and that is a really nice segue into another model I use a lot, and I've talked about this in a Ren video, I think, which is ball in the box. Someone must have done an infographic on this. I show you this stuff so you know kind of what I'm looking at, so you can find it yourselves instead of me just presenting this as if this is a nice simple one. Oh, look how little it is. Why are you so little? Here we go. So you have your life is the box, essentially. This is one I used in the Ren video when he was talking about, I think it might have been on the Hey Joe or something like that. Dear Joe. Hey Joe's by Jimi Hendrix. Or For Joe, actually, I think it was. So as it says, when grief is new, it takes up nearly all of your box. It takes up nearly all of your life, all of your resources, all of your experience. And this red thing indicates a pain button. So as that grief bounces around, it frequently hits this pain button. And when it hits the pain button, that's when you get the memories. That's when you get the emotions. That's when you get those kind of images that pop into your head. That whole experience of losing someone, it comes to you straight away. Then over time, the ball kind of shrinks. Okay, so it's slightly different to the previous model, but I still like elements of this. So the ball shrinks, and the knock-on effect of the ball shrinking is that there's more room in your experience for it to move about. But here's the thing with this model, it still hits the pain button. And when it does hit the pain button, it hurts just as much. It hurts just as much as it did in this first box. Okay, the periods of time when that button gets pressed lessen, they reduce. And then again, over time, the ball gets a little bit smaller and it has a bit more freedom to bounce around in your experience. But when it hits that pain button, it feels just as strong as it did at the beginning here. And this kind of, like, I can't really talk for anyone else's experience, but this is my experience, I think, is, you know, when I lost a family member, my pain button was getting hit daily, all the time. And then a couple of months later, okay, I could go a couple of days without kind of, you know, breaking down and sobbing. But when I was reminded by something, when I had a thought about something, that pain button was pressed. It was like they had just gone. I had the same experience as I did, you know, the first couple of days. And now, and this is years later, I have more space in me for that experience. But when I see something on telly that reminds me of it, or if I see something that reminds me of the circumstances of how they died, it hits me hard still, really hard. It's just those times that happens are now not as frequent. And I think often when you see, so, I mean, people, you know, and some of my reactions, you can tell I get quite emotional. You know, people see me crying and things, and, you know, it's like, oh, where did that come from? It's because it activates this. It's like I've been in this third part going about my day fine, and then I've heard a song and it's reminded me of something that's happened to me where I've grieved, and it's pressed that pain button. And as a consequence, that is my emotional response. Because it's not about the song, is it? It's not about the song itself. It's about what the song means to me and the connection I'm making with my own life of what that song is reminding me of. That's what the emotion is about. Let me just have a look at the comments. Okay, so Carol says she's fine to share, so I'll pop this up. I'm fine to share. For me, my man died on my birthday. Wow, okay. And it marked my celebration with my grief of losing my nan. So at some points it makes sense. The grief's still there, but I learned how to handle it. Yeah. And I wonder if we combine these two models, whether you learning to handle it. So learning to handle it is part of that growth journey. And as a result of that, there's more space for that ball to bounce around before it hits the pain button. But when it does hit the pain button, it hurts just as much because the size of that grief in the other model is still the same. So like the size of the grief that holds that emotional response gives you just as much emotional response when it's triggered. Like, I know it's a bit of a mishmash of the two, but we're not going to get a perfect kind of model that suits everyone and fits everyone's experience. But for me, these are the two models that I tend to share with people who I'm working with who might be experiencing something like this. Normally, sometimes I won't kind of refer to both. I might just refer to one or the other, depending on their experience and what I think is going to fit. But most people resonate with either one of these or both. And again, if they come to me and they talk about the 5 stages of grief, well, that's fine as well. Like, if that's their experience, that's their experience. I'm not going to take that away from them. We're trying to help be compassionate and give some comfort at a time that's really difficult, but also try to find some way forward for them, because, you know, everyone goes. Everyone's going to experience this at some point. Yeah, exactly, Carol. Like, so this, I mean, the ball in the box, and it's really easy, doesn't it? It's like, oh, that's how it works. But it's really effing hard and difficult when it does show up. Yeah, Sarah. So like you say, each grief is completely different and everyone's experience is different, which is why it's so hard to come up with a way to explain it to someone, I think, especially if someone's never experienced it before. That's why we won't have a model that just lays out exactly what it's like. Yeah, Jill, that's right. There is as well. And there's also research on the impact of grief on who you lose as well. So, for example, losing kids. the research says hits people. Well, okay, when I say it hits people harder, what I mean is people are more likely to clinically present with grief being as a problem. So the research, it says, this is training from this year, by the way, which I attended more from a trauma perspective. But rates of prolonged grief tend to be high after the death of a child or violent traumatic death. And the lowest rates are found amongst widowed persons. But that's a very specific clinical definition of what we're looking at. So I guess that raises the question, when does grief become a clinical problem? When is it something that you need intervention for? I was working with someone recently, another therapist who I supervise, and they had someone present to them with a bereavement and they clearly needed some support. And we had identified that. We identified that they would probably find some support quite helpful, but we had to give a diagnosis or a formulation. We had to give a formulation, and it had to be based on the ICD. And we were wondering how we were going to do that. And the reason we had to do it was because it was getting paid by insurance. So for insurance purposes, you have to have an ICD code. There has to be something that's treatable as such. Obviously, grief is a normal human experience to some extent. So what do you think we chose? And this wasn't because we wanted to say that there was something inherently wrong with this person's experience. It was we had to make a decision. Close. There's actually something called prolonged grief disorder. And you can see here what prolonged grief disorder is. So it's a disturbance in which, following the death of a partner, parent, child, or other person close to the bereaved, there is persistent, pervasive grief response characterized by longing for the deceased or persistent preoccupation with the deceased accompanied by intense emotional pain. Difficulty in accepting death, feeling one has lost a part of oneself, an inability to experience positive mood, emotional numbness, difficulty in engaging with social or other activities. And then we get into how long this must have happened for. So the grief response has persisted for an atypically long period of time following the loss, so more than 6 months at a minimum, and clearly exceeds expected social, cultural, or religious norms for the individual's culture and context. So grief reactions that have persisted for longer periods that are within a normative period of grieving given the person's cultural and religious context are viewed as normal bereavement responses. So even if it's been going on for more than 6 months, but that is expected given the culture, then there's not prolonged grief disorder. And it causes, you see this in pretty much every diagnosis, it causes some kind of impairment in personal, family, social, educational, or occupational areas. So we have this. And then you have, as usual, a list of what we would look for. So history of bereavement, the persistent pervasive grief response. It's lasted a long time and it results in impairment. And then then it'll give us some differentials as well. So differential diagnosis is, we might be looking at a PTSD response, a trauma response. So it says in prolonged grief disorder, the person may be preoccupied with memories of the circumstances surrounding the death, but unlike PTSD, does not re-experiencing them as reoccurring again in the here and now. So if you've seen any of my PTSD videos, you know one of the 3 core components of PTSD is reliving. So you wouldn't have the reliving element. And there's also a boundary with depressive episode as well. So are we looking at depression instead? So it says it's differentiated from depression because symptoms are specifically focused on the loved one, whereas depressive thoughts and emotional reactions typically encompass multiple areas of life. We also have some parity here with the DSM-5. Get rid of that. How do I search? Does this let me search? So it's also called prolonged. It used to be called complicated grief disorder, but I think they kept the name prolonged grief in the DSM. This is one of the changes of the DSM-5. What page is it on? Let's have a look. Here we go. 322. So in the DSM-5, so if you're from America, Then they've got at least 12 months within their diagnostic criteria, where the ICD was 6 months. And then they've got the development of a persistent grief response characterized by one or both of these. So an intense longing for the deceased person and preoccupation with thoughts or memories of the person. And then you need 3 of these things here. So disbelief, identity disruption, avoidance of reminders of the person, intense emotional pain, difficulty reintegrating into one's relationships. Remember, this is 12 months after. Emotional numbness, feeling that life is meaningless, intense loneliness. We've got the same bit as the ICD. It has to cause some kind of impairment. We got the same as the ICD regarding the cultural context. And then with everything that we have with the DSM, it can't be better explained by something else. And they mention here major depressive disorder, so depression, or PTSD. So again, parity with the ICD there. And if we go down here, they'll have a differential diagnosis section as well. So their differential diagnosis is normal grief, and they look mainly at the time frame here. And we've got depressive disorders, and we've got PTSD again. And we've got some other things here. So separation anxiety disorder, they say to consider. So separation anxiety disorder is characterized by anxiety about separation from current attachment figures, whereas prolonged grief disorder involves distress about separation from a deceased person. So that's a pretty clear distinction, I think. And then psychotic disorders, hallucinations about the deceased or transient sensations about the presence of the deceased are common cross-culturally during normal grief. Okay, so they're saying we expect some degree of hallucinations and transient sensations as part of normal grief. If we are looking at a diagnosis of something that's psychosis based, then they must also have other symptoms of psychosis, such as delusions, disorganized thinking, or negative symptoms. So it gives us some things to consider. Let's catch up with the comments. Carol asks, a question I have is whether grief can be the reason for traumas that generate other problems like triggers. I would imagine so. I mean, because what we have to separate, it starts getting difficult here because we start thinking of clinically, it might not be trauma, as in it might not be PTSD, but it still might be a traumatic experience for the person. So we're going to be careful about how we're using that, the language of the word trauma there. You don't, I do. So if someone does have some kind of traumatic experience and it perhaps involves, I don't know, attachment figure, for example, and they see that as a loss or an abandonment or a rejection in some way, then you could be looking at kind of a BPD type presentation as a result, because we know a high proportion of people who experience BPD presentations do have quite a traumatic kind of experience as part of their background. Oh, I think this responds to my question. Okay. Yeah, I mean, and this is something I was thinking when I was reading this, actually, because we tend to, and I don't know if this is my misunderstanding here, is that we tend to talk about grief and bereavement as like the same thing. Like it's always connected with the death of someone, isn't it? Especially in like the training I've been on, when we're looking at these two. I mean, the diagnostic criteria here, I happen to have this one open. Like the first thing, like A, what's A? The death. So like it's clear that's what they're looking at as part of grief. But I don't know if grief, I mean, well, it does in this context, like in this definition, but can we expand the definition of grief to mean like losing something, but not necessarily through death? Yeah, like Carol's brought up, responding to what Jill's saying. A grief at other losses not caused by death. Yeah, I hadn't read that, but that's what I was just getting at then. Like, it's an interesting way to frame it. Because clinically, this is the difficulty with clinical diagnosis and people's experience and how we use language and how we try to explain things. If you go and see a therapist or a diagnosing clinician who knows the ICD-11 or the DSM-5 inside out, and you're using the term grief and they're thinking, well, this isn't really grief as per the diagnostic criteria, but because you haven't lost someone or someone hasn't died, but perhaps you've lost someone, perhaps it's been the end of a relationship, then you still might be experiencing all the things mentioned in the diagnostic criteria, but it just doesn't meet that diagnostic criteria A of it being a death. But your experience is still your experience. It's still difficult. You're still struggling. It still has an impact on, like, an impairment on your functioning. Like, that hasn't gone away just because it's not written in the book that it can be a relationship that's ended. Like, it doesn't take away from your experience. And actually, what's really interesting is, from my perspective, is that the intervention for this, the intervention for prolonged grief, is based on a trauma intervention. So one way to do it, so we have a trauma model called Ellis and Clark's cognitive model for PTSD. It's the same model that's actually used for prolonged grief disorder because it's so close to trauma. The experience is so similar that actually the treatment's the same. So when, I think Sarah might have said CPTSD earlier as diagnosing someone, potentially, but ultimately the intervention is going to look very similar to a CPTSD intervention. It's going to look very similar to a PTSD intervention.